what can organizations be learning from each other? And I'm cognizant of the fact that every organization has their own culture, has their own business aspirations, has their own strategic priorities, has their own vision, has their own leadership style, all of that. Um, but are there ways in which organizations, and I'm thinking about sort of the collective look at the index and sort of the benchmarking and sort of that global view of mental health at work. How can organizations be learning from each other, be collaborating with each other? What kinds of benefits might we see if we as leaders begin to sort of look outside of our own walls, and think about this sort of collective task of addressing and improving mental health at work, as something that we might benefit from doing in
Mhm.
collaboration?
My experience in working with our founding corporate council, which is a group of companies from around the world that have come together to partner with our team, with the Ethisphere, One Mind, and Columbia University team in building out the Mental Health at Work Index, is that the opportunity to learn from each other is enormous. And when we can come together and build a space that where it's safe and there's high level of trust around commitment to these issues and struggle with these issues, right? These aren't easy issues for leaders to address, that there's huge opportunity. And there are two analogies that I have around the issues of culture and cultural difference, which for me just kind of set reference points as I think about how we think about culture in this work. One is that you've traveled to different parts of the world, right? And when you sit down at dinner and the wait staff brings something that is put on the plate with, maybe it's with some little condiment next to it that could be butter, or it could be olive oil, or it could be tahini. And it could be a leavened product. It could be flat. It could have seeds. It could have raisins. Like, everyone knows what it is, right? What is it?
It's bread.
It's bread, right? Everyone knows like, you've never had this form of bread before, but it's bread and you know it's bread. Well, when it comes to mental health, it's a little bit like all the breads of the world. Like, it's bread and if it's, you recognize it. And it doesn't matter if it has raisins or nuts or seeds, or it's flat or it's round or it's square, it's bread. And when it comes to mental health, once you understand the core principles, every organization, as you say, is going to have its own flavor, is going to have its own flair, is going to have its own version. But there are these common elements. We recognize it as bread. Mm-hmm. But then, the other thing is, in terms of the global exchange, for anyone that's learned a second language, you realize that you actually learn an enormous amount about your native tongue when you learn a second language. Things that you never thought about before, all of a sudden become very clear. And it's in this contrast that actually you're not only learning a second language, but you're learning more about yourself. Mm-hmm. And that's really what the opportunity is here in terms of the global conversations and discussions. It's about understanding that we're all going to kind of recognize the bread, but that in the conversations, we're going to learn a lot, not only about how some organization does things differently or similarly, but in learning that, we're going to learn more about ourselves and how we do things, and things that we never thought about before will become conscious considerations for review.
Wonderful metaphors and analogies to really start thinking about, and again, to move that analogy or metaphor forward to chew on. The idea is a lot of rich information here that I think individuals and organizations can take back and start to really think about how to start doing this right.
Mhm.
And to do it right, I'm curious about some resources that you might want to share with us, or that you could give people right now to begin to do the work.
Mhm. So, a couple of things. First, I would invite anyone who's interested in further conversation to reach out to me. Happy to hear from people. And so people can email me, and happy to have further conversation. In terms of online opportunities, the Mental Health at Work Index is mentalhealthindex.org, and people are welcome to visit that site and reach out to us. We are early in launching the Mental Health at Work Index. So right now, we have an incremental strategy for engagement, and we'll be bringing the Founding Corporate Council on, and then an extended network of companies and organizations. And after the new year, we'll have capacity to bring on organizations freely from around the world. So, but people are welcome to reach out to us, and there's a contact button on that site. I also want to bring to people's awareness that the World Health Organization has recently released materials regarding recommendations and guidelines for mental health at work. And those materials are really important in terms of setting priorities and expectations around workplace mental health, and freely available. And One Mind at Work has materials available to organizations, as do a number of other organizations. I should mention McKinsey has recently released a global report on the burden associated with workplace mental health, and sort of a report on the status of the mental health of employees and workers around the world. So there are a number of different places to go to get started or to further the conversation. Maybe I'll stop there.
I would
Excellent.
just add that from a Kotter perspective, there's a litany of sort of stuff to read available in terms of how to make some of these changes and how to start thinking about transforming culture. But specifically, and it can be found on our website, all of our most recent research is around the blend and sort of connectivity between neuroscience and adaptability and leading through change. And there's a whole section on our website about that concept of survive, thrive, and a number of resources there that can help folks learn more about it, build more awareness, but also start to think about what are some ways in which I can make change in this specific area. So not to kind of call out all of the change stuff, but specifically, I think that is where people can find some good, real, actionable material value of sort of where our research has been leading in the past few years.
And Rachel, the connection, the links that you're drawing between neuroscience and behavior change in organizations is so important, because if we don't, the more we understand about how the brain works and how information gets processed, the more effective our strategies can be, right? And we're seeing that right now, for example, I've done a number of consultations with organizations about bringing employees back to the workplace and various combinations of doing that. And I hear from organizational leaders that they want to wait until people aren't anxious anymore. But we know from the anxiety data that the way people overcome anxiety is with appropriate, gradual, graded exposure, right? So it's not going to happen by waiting and not doing anything. And that's a really good link between our understanding of mental health, symptoms, neuroscience, and behavior change. And the work that you're doing more broadly than that, I think, is going to be really, really important in the coming years, because we're able to more specifically identify those kinds of links that will make a huge difference in terms of efficacy of interventions.
Mhm.
Well, we couldn't agree more.
Right.
And we get to see it every day, which is, I think,
Yeah.
what makes us so passionate about the work that we do, because you get to see those individual stories, you get to see the organizational accomplishments, you get to see people's lives changing for the better,
Yeah.
which is encouraging
Yeah.
and inspiring. We get to be inspired by the people we work with every day. My goodness, thank you for
Thank
the time,
you.
the thoughtfulness, the richness. Holy moly.
Well, thank you. It's been so fun.